Yes, so welcome to yet another exciting moment with us on this program, Women's World. I'm Umotola Adokai Ogundele. Today we are looking at something very, very important which has to do with our health. We are looking at cervical cancer. I'm having Assistant Chief Nursing Officer Adekoya Fumilayo that will be telling us more about cervical cancer. You're welcome to this program.
Thank you so very much.
Okay, so now we're looking at cervical cancer. What actually is cervical cancer? Or let's look at what cancer is, then cervical cancer.
Okay. Cancer is the abnormal growth of cells in the body.
Okay.
It can grow anywhere in the body. That is the word cancer.
Okay. That means we have normal cells before.
We have normal cells.
Okay.
There are cells in our body. They function very well in the absence of diseases.
Okay.
But once there is an infection or once there is a problem with the body, the cells might start growing slowly and abnormally. It now depends on where the cell grows. That's what will make us to attribute it to a particular part of that body.
Okay.
If it grows in the throat, we say cancer of the throat. If it grows in the vagina, cancer of the vagina.
Okay.
If it grows in the cervix, cancer of the cervix. If it grows in the uterus, cancer of the uterus. So that's how we give it the names.
Wow. So what actually, okay, now let's look at cervical cancer, which we are dealing with today.
Okay.
So what is cervical cancer? What are the causes of cervical cancer?
Okay, cervical cancer is the cancer that grows at the lower part of the uterus, that is the cervix.
Okay.
And this cervix we are talking about is a linkage or pathway between the uterus and the vagina.
Okay.
And the causes, of course, any cancer, the cause is usually unknown, but we have some predisposing factors.
Okay.
Or the risk factors. One of the factors that can make someone come down with cervical cancer is having multiple sexual partners. That's number one. Number two, grand multiparity, having more than necessary children.
Wow, is that?
Yes, is another factor. Another factor is smoking, bad lifestyle, smoking.
To the cervical cancer?
Yes. Then another factor that can also, affect someone or make someone come down with this cancer is how do I put it now? I've talked about smoking,
Throat, yes,
grand multiparity, yet early exposure to sexual intercourse.
Okay, early again.
Early exposure to sexual intercourse
Can cause cervical cancer.
Yes.
Wow.
Can cause cervical cancer. Majorly, there is a virus that a man actually transmits, that a man actually carries.
Okay.
We call it
human
papilloma virus.
Okay.
This virus has difference about 100 strains of this virus, of the strains of this human papilloma virus. But out of this 100 or more than that, only 2 lead to this cancer we are talking about. For instance, we have HPV 16 and HPV 18, that is human papilloma virus strain 16 and strain 18, which a man has or carries and
can transfer to a
can
woman.
transfer or infect the woman.
Okay.
But not every woman that is being infected with this HPV virus that usually come down with cancer.
Okay.
Some women might outgrow the process in the space of 2 years. If the immune system is very good, the woman may have the infection and may not actually come down with cervical cancer.
Okay, now you listed some things that can cause this cervical cancer. You said early exposure to sexual intercourse.
Yes.
How does that really affect cause cervical cancer?
Do you know that when we are talking about early exposure to sexual intercourse, there are some
young girls,
yes, there are some young girls that even their immune system, their reproductive system is not even developed enough. Immune system is not well built, and if they have had contact or intercourse with a man who has gotten the virus before, they might easily be infected. That is what we are saying there.
Okay, now you talked about smoking again.
Smoking.
Why is the smoking affecting cervical cancer, not the truth?
Thank you so very much. Do you know that smoking can make the immune system to break down?
Okay.
Someone that is having bad lifestyle and even smokes, all those cigarettes have some content or chemicals that may actually affect the immune system.
Okay.
And anything cancer, that is why people that are immunosuppressed, like the HIV patients, they are more liable to developing this cancer we are talking about, because the immune system is already low. It is already down.
So what actually is causing that human papilloma virus in a man?
Human papilloma, you know, there are many viruses. We have HIV virus is here.
Okay.
Hepatitis B virus is there.
Yes.
There are so many other viruses. We can hear of coronavirus. These viruses are many. So it now depends on which one we are talking about.
Okay. So now, how we've talked about the causes now. So how do we manage it? How can we prevent it? What are other ways can we prevent it now? Because we have looked at the causes. How do we prevent it?
Thank you so very much. When I was talking about the causes or the risk factors,
Yeah.
I made mention of something.
The immune system.
Immune system. Number one is to build that system. To boost the immune system,
Okay.
ensure we take adequate fruits, adequate intake of green vegetables. Exercise is also one of the things that we can do. Then we also ensure we take enough water. Water
Okay.
therapy is very, very good.
Okay.
Then I also said something on grand multiparity, having multiple, having many children.
Okay.
So
How does that affect?
yeah, it's a service.
Yes.
Is the service is the neck of the uterus.
Okay.
The service, the cancer we are talking about, may not develop as cancer immediately. It may start slowly in form of infection or infection. Any infection of the reproductive tract that is not well treated can lead to any form of cancer.
Okay.
So that is why I said, if a woman is having more children, and is not even well taken care of, but eventually during the last delivery,
It might break
the
down.
service might have even been tampered with.
Okay.
Maybe she has cervical laceration that was neglected or that was not taken care of. That one was left there without being sutured. Maybe the woman did not even go to a government hospital. She delivered her home. And she started using so many things to even put in there, using different herbs to heal the wound that is here. Before you know it, the place will start smelling. From there, it might degenerate to something else. And the cancer itself, will not develop in one day. It may take some years before it will start manifesting as cancer.
Okay. How do we now? What are the symptoms? The
Symptoms of cervical cancer.
Yeah.
Oftentimes, many women confuse the cervical cancer symptoms with urinary tract infection and menstrual flow or menstrual period,
Okay.
because they come down with
Spotting.
unusual vaginal bleeding. That's number one. Number two, painful what is it called now? Sexual intercourse.
Okay.
Number three is painful micturition when voiding or urinating. Then
Okay.
pain around the pelvis is another factors, and those factors may be confused with urinary tract infections. Like someone that is coming down with UTI, PID will have those symptoms I just mentioned about.
Okay. So now, how can it be treated?
Okay.
With number one, is there any symptom? You said it will come with painful stuff, but some doesn't come with any trace at all. So
Yes.
how can one treat it now?
If it doesn't appear in that form, like in showing the woman is having complaints of unusual bleeding, painful micturition, of course we can't say somebody is having painful micturition is having cancer of the cervix or cancer of the vagina or cancer of anywhere. As women, we need to check on our health regularly
Okay.
by going to the hospital, like in state hospitals, they run the preliminary test called cervical cancer screening
Okay.
with acetic acid. We call it VIA, visual inspection with acetic acid.
Okay.
And that test has a long way to determining if the client is positive or negative.
Okay.
So once the client is changed with the acetic acid and there is a kind of reaction around the cervix, we call it transformation zone or transformation junction, the T zone. If there is an acetyl white lesion there, it means the person is tested positive.
Okay.
We may then refer to a higher level facility for further or confirmatory test.
Okay.
So if it is positive at that level, then they will take up the treatment from there.
Okay.
Like for instance, now there are many treatment options. Surgery is one of the options, but it depends on the discretion of the surgeon or the gynecologist to know which type of option will be best used for this kind of patients.
Okay.
Before a patient can be considered for any treatment option, there are so many other factors the gynecologist must put in place, like the immune system. Is the person able to go through the surgery if the surgery is the option that the client is going to benefit from? Is the immune system good enough? Will the person be able to skate through the process of surgery? Number two, does the client have desire to having children?
Okay.
Then the age of the client that you want to put into the that you want to
Okay.
Yes.
You talked about does the person want to have more children?
Yeah.
How does that affect the treatment of cancer? How does it affect having more children?
So that the gynecologist might be able to know if it is chemotherapy that will be best used for the patient, that is the use of drug, or the surgery that will be used. It depends on the gynecologist's discretion and whichever option that.
Okay, if person is going to have more children,
they might not want to use a particular method for that particular individual.
Now you talked about age also. I'm looking at age in the sense that when I was doing my own research too, I found out that people within the age of 20 might not likely have cervical cancer. How true is that?
The reproductive age now has now declined.
Okay.
In the sense that even we have had some clients in the past, not more than 14 years, 15 years having children. They will now say that they are not likely to have it.
Okay.
So any woman within the reproductive age is liable to have it. Like when I was introducing or I was mentioning, I said early exposure to sexual intercourse might actually be a predisposing factor.
Okay. So now, when we treat this cervical cancer, does it have any, like taking the treatment, does it have any side effects when one is being treated of cervical cancer? Because I know some cancer, when they are treating one of cancer, they will say the person will lose hair, lose this and lose that.
Yes, for instance now, if the treatment option is chemotherapy, that is the use of medicine. The use of medicine, and it is used in an advanced stage of the cancer. So it's likely the patient come down with alopecia, that is loss of hair.
Okay.
And like
the early stage of the treatment, like you said, women should always check.
It's better.
Do cervical screening and all that.
Yes.
Is it expensive, like one going to a state hospital?
Not at all. It's not expensive.
Anybody can
can afford it.
Okay.
It's not expensive.
We'll be going on a break. Do stay with us, don't go away.
HPV is also known as the human papillomavirus. It's a very common virus that lots of people have. HPV is different to HIV. HPV usually does not cause any harm, but sometimes HPV can cause cervical cancer in women. Both men and women can can have HPV. Boys and girls are offered an HPV vaccine in secondary school. This vaccine can help stop some types of cancer from happening. HPV doesn't have any symptoms, so people don't know they have the virus. HPV is usually passed from one person to another by having sex, touching each other in the genital area underneath your pants, sharing sex toys. In most cases, HPV goes away by itself after a while, but in some cases, HPV can stay in your body and cause the cells in your cervix to turn bad. The bad cells can lead to cervical cancer. When you go for cervical screening or a smear test, they will check for HPV in your body. Having HPV in your body means you'll be checked more often to make sure you're healthy. Lots of healthy people have HPV. If you have HPV, it doesn't mean you will get cancer. If you're worried about HPV, you can speak to your nurse or doctor or visit these websites.
Welcome back. We've been looking at cervical cancer, and with me in this studio is Assistant Chief Nursing Officer Adekoya Fumilayo. Once again, you're welcome.
Thank you so much.
So now, you've talked so much about cervical cancer, but is there any other chances of the cancer when it's treated returning back?
Okay, thank you so very much. It can, or it may likely return, depending on the lifestyle of the individual.
Okay.
The individual. So, if the person is immunosuppressed, having been treated, might actually come down. If the person has a bad habits, lifestyle, it may also return. And if the person is the type that doesn't care about the health, anything goes, whatever you see you eat.
So what we eat again also affects?
Yes, what we eat also do affect.
Okay. So now the human papilloma virus is normally in a man.
Yes.
Does it cause cancer too in a man?
Yes, it does.
Okay.
It may lead to cancer of the penis in
Okay.
man. Sometimes cancer of the throat. So in men with like that practice homosexuality,
Okay.
so it may lead to some other cancers in men.
Okay. So now what other side effect do we have in cervical cancer?
Side effects.
Yes.
You mean after the surgery?
After after the surgery?
After the surgery, it depends. The person might end up with infertility. That's why you must weigh the treatment option before the patient will undergo a particular method.
Do we have good doctors? Do we have good hospitals in Nigeria that, let me say,
Yes.
standard hospital that can handle the
There
issue?
are a lot of them.
Okay.
University College Hospital is one of the best hospitals.
Okay.
So that handles the stuff.
Okay. So what advice do you have for people, most especially people that already maybe they're having this cancer already? They are scared of even telling anyone, and people that are living a wrong lifestyle that might likely come up with this cervical cancer.
I'm not saying everybody living a wrong lifestyle might actually have the cervical cancer. Of course, if the person doesn't come down with cervical cancer, it may come down with so many other disease conditions, like sexually transmitted diseases, like HIV, AIDS, and like that.
Okay.
So my advice is for people to just make sure they take care of their health. Women should go to the hospital for regular checkup. Men should also go to the hospital for regular routine checkup.
Okay.
Then we should ensure we build our immunity or immune system. Like cancer can be in the body, or someone might be infected with any kind of virus, and the virus might not actually break down the system if the immune system is strong.
Okay.
So we need to take adequate fruit, adequate water, then green vegetables, and live healthily, so as to prevent this cancer and some other disease conditions.
Okay. Thank you very much. Thank you for coming, and thank you, viewers at home, for being there. You've heard it all from Dr. Adekoya Fumilayo.
Nurse.
She has told us.
I'm a nurse.
Sorry, a nurse, a chief, assistant chief nurse, Adekoya Fumilayo. Okay. Okay, you've heard it all from Assistant Chief Nursing Officer Adekoya Fumilayo. She has told
Because
us
cancer
a lot.
doesn't kill.
Okay. The cancer doesn't kill.
Yes, early detection saves life.
Okay. Now she's telling us more. Early detection saves life. So when she also advises us that we should always do regular checkup. So to come away again on the same program next week, I believe you've learned something for this program. Just stay with us. Don't go away. Bye.